Hi, this is the online YouTube, and it is the overview for Skills Lab number 1, which is going to include Asepsis, PPE, which is personal protective equipment, hygiene, and safety. As for all labs, you will refer to your Blackboard course, and in there will be all the information that you need. There is a PowerPoint that goes along with this. It's essentially this PowerPoint. You do not need to print it out if you watch the YouTube. It has everything that's the same. There's a student handout under Lab Prep, and that includes all the readings, objectives, what you need to do as far as the skills videos, reading what you need to bring to lab and that sort of thing. So I would really take a look at those student handouts for each lab to prepare yourself. For this one here, for Mosby's, you can sign in here if you want to get to the skills videos. There's 3 videos that you need to watch and complete the online review questions under the basic infection control category, hand hygiene and PPE, isolation precautions, and under bathing category, performing a complete or partial bath. Now, some of you are familiar with this. You do need to review it, and everyone needs to complete the online review questions, and you need to get a grade of 90 or above in order to come to lab. Now, this is our first lab, so I'm going to give a pass to everybody on this one because some people might have some issues and that sort of thing. But starting with lab 2, you must have your videos, online review questions done in order to attend lab. There are readings and simulations that are going to go along with this lab, and you can find out more information on those in your student handout. Now, to start off your labs, I want to go over QSEN, and QSEN stands for Quality and Safety Education for Nurses. This is an organization of concerned nurse educators and nurses in the field concerned with preparing you, the nursing students, for practice and making sure that you practice competently and there is science behind your practice. And what this organization has come up with is that there's these elements that pertain to quality and safety for you. And yes, it's patient-centered care, it's teamwork and collaboration, evidence-based practice. You need evidence to support why you do what you do. Nurses are all about quality improvement and improving our skills and our care. Safety for us and the patients, and of course informatics. You will be becoming very familiar with that because it's becoming even more important in the clinical place. QSIN safety, because this is going to be a major focus of this lab. Definition is minimizing harm to patients and providers. So it's not just the patients, it's you too. And we need to look at this through system effectiveness and individual performance. So yes, we need to teach you the correct way to do things, but we also need to give you those tools. And that's what system effectiveness is all about, is how do we make it so you can do your job and do it well and accurately. So without further ado, let's get into the nuts and bolts of this lab. Aseptic technique, there's 2 types, the medical asepsis and the surgical asepsis. And we're going to be mostly concerned with medical asepsis for this lab, and this is what I can also call clean technique. And we can reduce the spread and prevent of microorganisms, i.e. this is hand washing. Basically simple hand washing. Surgical asepsis is where we actually eliminate microorganisms. So there's a big difference between medical and surgical. Hygiene, along with asepsis in long-term care facilities, hospitals, wherever you're working, is actually, we will be covering bathing. And in long-term care, essentially, a bath or shower 1 to 2 times a week based on, if they need it more often, but basically that's what they do. On non-bath days, you do partial baths at the bedside, sink. You really want the folks to do as much as they can by themselves. It's up to you to make sure that they are clean and do pericare, perineal care. They need to, if you can, dress them in their own clothing. Make sure you take care of their nails, hair, skin, oral hygiene, that sort of thing. So that is going to be expected, and we'll be going over that in more detail in the lab. So as far as oral care is concerned, it is a pet peeve of mine, and you'll probably know that. But for this slide, I want you to just sit there and imagine that you're a patient in a skilled facility recuperating after a stroke. Your right hand and your left leg are flaccid. In other words, you can't move your right leg and your right arm, okay? It's 5 o'clock in the afternoon and you haven't had any oral care today. You haven't brushed your teeth. You haven't swished out your mouth. And you're sitting there and unable to do it by yourself. What do you feel like? What do you think you feel like? And what I always want you to do is put yourself in their shoes. You take care of folks the way you would like to be taken care of, and that is not skipping oral care. It's very important and for the patient's health and safety. Say, for example, they have dentures. You need to take them out. You need to brush them. And if you take a look at this picture here, what's wrong with the picture? Why is this not the correct technique in order to maintain dentures? We can talk about this in class. But also, oral care and evidence-based practice. What do you think evidence-based practice has to do with oral care? If you think about it, if you have poor dentation or not taking care of your teeth, you have a growth of microorganisms in your mouth that could spawn an infection. And then that can be quite detrimental to the patient depending on what type of infection it is. So everything we do, there is a reason. Perineal care, another pet peeve of mine. And all I can say is get used to it, get over it, and get on with it. It must be done. If they are unable to do pericare themselves, then it is your responsibility to do it. And again, evidence-based practice. Folks need to stay clean because it will decrease the amount of skin excoriation, it decreases the amount of skin infections, and basically makes them feel better. So again, you always want to make sure that their perineal area is clean. And when you bathe them, no two ways about it. You get all the soap off and you dry them well, because the more soap and wetness that you leave on them, the more area there is for spawning bacteria growth. So there is a rationale for that too. So now I want to switch gears just a little bit, and I want you to think of 3 words that you associate with patient safety. You know, we've been talking a little bit about hygiene and medical asepsis and that sort of thing. But think of 3 words, just 3 words. Just write them down and bring them to class. I would like to see what it is that you come up with. Then, after you've written them down, I want you to watch the video on the next slide. Now, this is 3 words. Keep patients safe. And this is a hospital's rendition of how they keep patients safe in their hospital or facility. And you can watch this either by clicking, control click on this link here, or you can cut and paste the link and just put it right into your address bar. It's a 6-minute video, and I think you'll find it quite eye-opening. And we'll be talking about this when we get to lab. And when it comes to safety, approximately 1 out of every 20 hospitalized patients will contract a HAI, which is considered a hospital-associated infection. And this also considers long-term care. It also includes rehab. So these are places that you are going to be practicing this semester. And what happens is that if folks get an infection while they're in our care, that their stay is longer, their complications are higher, and it costs more money. And it costs us up to $33.8 billion a year. And you can see the references I have there. $33.8 billion. And what you're finding now is that facilities are really looking at what it is, what infections that they have, and how can they decrease them. And actually, some facilities are not getting reimbursed if their infection rates are too high. So you're going to see all kinds of new elements being done to try to decrease hospital-acquired infections. And you know, it all comes down to washing your hands, drying them thoroughly. On a wet surface, microorganisms move and multiply quickly. That's why we use a dry paper to turn off the faucets. You don't want to get your uniform wet, and certainly want to make sure that your patients stay dry. So, as far as personal hygiene is concerned, this is some elements that I wanted to start right off with, that I wanted you to be what we are looking for you in the clinical setting. Restrain your hair. You need to have your hair back from your face. It looks more professional, but also you can drop organisms onto your patient if you're doing a dressing, if you're, washing their face or whatever. It's not clean. It's absolutely not clean. Keep your nails short. No acrylic nails are allowed. Chip nail polish is not allowed. So, but we can wear nail polish, but see your agency policies on that. The same with jewelry. Jewelry can contain microorganisms and bacteria. So, again, see your agency policy and keep it to a minimum. You have any scratches, that sort of thing, make sure that you cover them. And no perfumes or colognes in the clinical setting. We do have folks that are highly, highly allergic to these, so you will be unable to wear them. PPE, personal protective equipment, you're going to be going over in the lab. We'll learn how to put this on, take it off. This goes anywhere from gloves, booties, mask, headwear. So you'll be very familiar with this. You'll be very comfortable taking this on and off and using this in the clinical setting. And finally, where we started, your entire practice is based on the CUSIN principles. And it, we use them of evidence-based practice, patient-centered care, teamwork, quality, safety, that sort of thing. And you need to value those elements in CUSIN and in your practice. So that's it for this one. And any questions, please email me, or I'll see you in the lab. Thank you very much.